All right, ladies and gentlemen, thank you for attending our webinar. And this webinar today is about reconstructive surgical missions. My name is Thom. I'm a global health doctor from Amsterdam. I'm part of Global Surgery Amsterdam. I'll be your host of today, and we are very pleased that you are joining our webinar. And we are also very pleased that we are collaborating together with ICOplast, and also special thanks to Hinne Rakhorst, who made this webinar available to us. Today we have several presentations. Let me start this presentation correctly. First, we have an introduction by Dr. Scott Corlew on the background of surgical missions. Then I'll present the current evidence on reconstructive surgical missions. And the third presentation will be the questionnaire presented by Fleur Smit and Keetelaar. And we just have sent you an email with the questionnaire. You can find the link in your email inbox and open the questionnaire. But we will fill in the questionnaire together later. And at last, you can send your questions to me by email. So the introduction will be done by Scott Corlew, and he is a lecturer at the Harvard Medical School at the program in Global Surgery and Social Change. And he is also the head of the Humanitarian Committee of ICOplast. And we are very pleased that he's joining today. He's presenting from Florida. So we are very pleased that he's here, and yeah, we will switch to his screen so he can give us the presentation and give us the introduction to the missions. So Scott, the floor is yours. I'll stop my screen share now. And you can start.
Thanks very much. And hopefully that gets my screen correct. Okay, can everyone see and can everyone hear? I'll take that as yes, excellent. Okay, so just a quick and dirty introduction to the concept of the short-term surgical trip, the mission concept. This sort of thing has probably always happened, but it became in plastic surgery, it became much more formalized almost 50 years ago when Interplast was founded. As it didn't take long as time went by for other organizations to spawn from that. Operation Smile grew out of Interplast a few years later. And since then, there's been Rotoplast and Physicians for Peace and various other Interplasts all around the world, Interplast Australia, Interplast Germany, many of them around the world. And there are well over 150, 200, 300 such organizations today. These run mission trips, short-term surgical trips, and most of them run a variety of other programs as well. Let me say something about the early evolution of the concept, though. It wasn't just the missions, it was the thought of what else can grow out of those. And I would encourage everyone to go back and find Chris Hughes' paper in Plastic and Reconstructive Surgery in 2013. It's a wonderful short history of the Barsky Hospital Project in Vietnam. Arthur Barsky actually wrote a contemporary version of this in 1970, and Chris went back with a nice history. Well worth your read. More recently, a number of training programs have grown out of what started as the surgical mission model. So from that, let's talk about what surgical mission trips do. And of course, the main idea behind them, for starters, was to provide care for people who otherwise do not have access. And of course, in many cases, that's true. In many other cases, that is not true, simply because people already have access. So other motivations have arisen that are not so laudable. Allowing foreign surgeons to go operate, especially doing things that they may not do at home and may not do well. Bringing foreign trainees to low-income countries just to augment their training. And perhaps the worst is to be a great travel mode. So hopefully we have moved beyond these things that I have in pink here and moved more toward the use of the short-term trip as a tool to assist and promote the development of access to surgery, because that's really what we're trying to do in the global surgery world, is increase the access to surgical care in places that don't have it. Let's talk a second about outcomes. Outcomes for the patient, of course, are immediate. For the local medical community, they're generally short-term. The local medical community is generally going to work with a foreign team, and then, of course, is going to pick up the pieces after the foreign team leaves. But for the healthcare system, with good planning and implementation and longer-term evaluation of the trip, the healthcare system in the long term can reap some real benefits if things are done well. So how should things be done well? And it really is the responsibility of the NGO or university, government, whomever. You can see what I have on the slide here, but generally an NGO, to work with the local community on the site to make sure that the trip will be well executed, will be planned properly, and will be used for the purposes for which it's meant. This last slide is just a series of articles that I would recommend anyone with an interest to read. Obviously, this is a very short bibliography, but these are all ones that are worth reading. And Thom, I assume that everybody will have access to the slides, or certainly do now. Anyway, these are just a list of articles that I hope you'll find worthwhile. And with that, I will stop my screen, Thom, and turn it back to you.
Yeah, now you can hear me.
You're muted. There you go.
Yeah.
Yes.
I'll start the screen share again. Sorry, my computer was not working along. Thank you, Scott, for this very nice introduction to the short-term missions. Yes, but I'll explain later again. The whole video is available on YouTube later on. So everyone who missed it or want to look back slides can watch it on YouTube later on. I'll share it on the social media of Global Surgery Amsterdam. But I think it was a wonderful introduction to the topic. I'll present now the second presentation, which is about the short-term missions and the evidence we have found. And I'll present the systematic review which our research group, Global Surgery Amsterdam, has done recently. On this picture, you see me as one of the doctors working in Haidom. And I'm a global health doctor. I'm trained in the Netherlands for 2.5 years. And then I went to Tanzania to work as a doctor. And that in that hospital, I saw many short-term missions, all kind of varieties. But also, I saw a lot of patients which had problems and conditions that were or that are treatable by reconstructive surgical care. Examples of those conditions are facial clefts, burns or burn contractures as well, Noma disease, which is a gangrene of the oral cavity, and complex wounds, such as open fractures. And all those conditions have in common, they are treatable by reconstructive surgical care, but they also have a very big impact on the patient's health. And as was said by Dr. Corlew, short-term reconstructive surgical missions are in the beginning planned to provide this type of care to patients who might not have access normally. And in my hospital, there were no plastic surgeons. So we had missions over there who provided this type of care, and that was done during a mission of 1 to 3 weeks. It provided specialized care, for example, cleft care. And besides providing healthcare, they also had other aims, for example, of providing training as a sort of capacity building and access capacity building of surgical care. And we know, besides my hospital, that there are many NGOs involved worldwide providing this type of missions. But what is their impact? And when we look into the literature, there are several concerns. And for example, there's concern about the accountability of missions due to a lack of outcome measurements, but also concerns about the safety of missions. For example, there are limitations in the quality of care provided by missions, or the lack or limitations of follow-up following a mission. And also the sustainability is often questioned. They all aim, or some of them aim, to improve the capacity of the local healthcare system, but what is the effectiveness of this approach? And a systematic review on reconstructive surgical missions was missing. So our research group performed a systematic review, and we did this according to the PRISMA guideline. We searched synonyms for short-term missions and reconstructive surgical care, or the conditions I mentioned earlier. We searched in 5 databases, and we also did a quality assessment according to the Oxford CEBM and the GRADE approach. And we included data on 4 key features of short-term missions. And on the on the picture on the right, you see one of the anesthetists working in my hospital. And from my experience, I know his important role of taking care of patient safety during surgical missions. But besides patient safety, we included data on basic characteristics of missions. Examples of that is, for example, mission length, number of patients treated. We collected data on patient safety, such as complication registration. We collected data on the surgical outcomes, for example, of improved range of motion, improved speech. We did also include other types of methods, including patient-reported outcome measures. And we also included sustainable characteristics of missions. For example, this included data on training of training activities of missions, or advancement of local staff. We found over 2,000 studies, and according to the PRISMA guideline and predefined criteria, finally, we included 41 studies, and the quality of studies was low. Most of the studies were case series, and few of them were economic evaluations. And regarding basic characteristics of missions, the average length was about 10 days. Number of patients treated was over 1,200 per study on average, and female-male ratio was about equal, with an average age of about 13 years. Regarding patient safety, we found that 9 studies didn't report any complication rates. 12 studies reported a complication rate of 1.3%. And studies which reported on the quality of follow-up, for example, on the follow-up duration and follow-up rate, reported higher complication rates. And for the studies with a follow-up duration of more than 180 days, they reported highest complication rate of 22%. For surgical outcomes, we found that 12 studies reported on surgical outcomes, and they all use different methods. Examples are patient-reported outcome measures, speech tests, questionnaires, dailies averted. And overall, they reported positive outcomes. But due to the heterogeneous data they provided, we couldn't draw any definitive conclusions, and also the evidence is still limited. Regarding sustainability of missions, for example, we collected data on training activities of missions. We found that 13 studies reported data about this. And we also found that the studies reporting on sustainable characteristics also were reporting on the quality of follow-up. So for conclusions, limited evidence was available, and it was of low quality. The lower quality studies, which did not report on follow-up quality, seem to overestimate the positive effect of missions. And there also seems to be an association between missions that are reporting on sustainable characteristics. They also are able to provide quality follow-up. future studies, we believe that those studies should include longer-term outcome research, and they should also evaluate the effectiveness of training activities. What about specialty hospitals? Specialty hospitals provide also surgical care to patients who might not have access normally, and they do this year-round. And an example of this approach is, for example, Operation Smile. They built a CLATSCAT center in India, and in a study of Operation Smile, they showed lower complication rates. And also Smile Train has a similar approach, but is doing this in many countries, and they showed also lower complication rates compared to short-term surgical missions. But the Smile Train had also limited information on follow-up. And given that we have a few studies with also a varying quality of reporting on follow-up, we cannot draw any definitive conclusions, and we need more high-quality studies to fully assess the strengths and weaknesses of both approaches. So here on the picture, you see me together with my colleagues, and without the help of an NGO, it was not possible for me to work in Tanzania. So I'm very thankful for that. And I think the future role of missions is that they still can deploy surgical specialists to low-income countries and to help patients who might not have access to surgical care normally. But they can also try to improve accountability, and they can do that by implementing longer-term outcome research into missions, and they can also collaborate with local researchers. Another approach is that they can develop towards sustainable partnerships, which is also called diagonal development. This means that they still invest in vertical inputs, for example, in providing surgical care, but they also try to have horizontal inputs. And this combined approach is called a diagonal development. An example of this is that they still provide surgical care, but also provide longer-term training activities. And those training activities should be embedded in the local healthcare setting. So on the basis of this review, we started a research study ourselves in the hospital where I work. And we started a research study on contractor release surgery. And here you see one example of the patients we treated and we performed surgery on, which is a contracture of the upper extremity. But we also provided follow-up for over 1 year. And here you see the example of one patient at the follow-up of 1 year. And we are still continuing this research project. So thank you. These were my slides. And also here I have summarized the articles we have used for this study, which you can look back later. So now we proceed to the third presentation, which will be presented by Anna and Fleur, and they will present the questionnaire.
Hello, welcome everyone. I'm Fleur Smit, and together with Anna Keetelaar, we have been working on the next step about this subject. According to our pilot study in September 2018, all the reconstructive surgical missions share one goal: improving outcomes of patients all around the globe. However, different strategies are used to accomplish this goal. Besides, there is a huge difference in change in approach the last years, and the causes of this also varied. Likewise, there's no clarity about it in the literature. It is unclear what is being done, and it's unclear how these missions are organized, what Thom just pointed out to us. Because of these reasons and the importance of this topic, we want to ask your opinion, people who are experts on this topic. Therefore, we developed a questionnaire of only 20 questions. Your data will be used to provide more clarity on today's practices of short-term missions, and it's in collaboration with Global Surgery Amsterdam and Icoplast. It is the first step of identifying what is currently being done and what should be done according to your valuable experiences in the field. And I think it is good to point out that the outcomes will be anonymized, so you can share your true and honest opinion with us. Good evening, everybody. Fleur, thanks for the introduction. Well, after this slide, together we will fill in the questionnaire about your experiences about this subject. Please tell us honestly how you currently perceive the methods, the workflow, and your experience with the missions. In the future, together we can improve the impact and subsequently improve care and future strategies for reconstructive surgical missions. We just sent you the email with the link, so please find the link in your email box and please fill in the questionnaire individually. And please also share with experts in your social network this questionnaire. And now I will go to the questionnaire with you together. If you have questions, please send it to tom.hendriks@gmail.com, and then we will answer it at the last slide or later on. This presentation will be available on YouTube as well, so you will be able to participate with the questionnaire later on as well. No, I can. Yeah. Let me see. Yeah, it's okay.
Okay.
Okay. Yeah. So I shared the questionnaire now.
Yeah.
Okay. So now we go to the questionnaire together. And I would like you to fill it in at the same moment as I do it. And if things are unclear, please tell us by email or afterwards. Then we will see what we can do for you. So in the first few questions, we would like to have some general information about you. So question 1, please fill in your name. So I will do it, for example, with the first question. Later on, you can just do it yourself. Please make sure you fill in something, because otherwise you cannot move on to the next question. Then question 2, please fill in your age. Then question 3, your sex. And question 4, your email address we can reach you on. And then question 5, please fill in your nationality. Yeah, doesn't matter so much. Okay, then please fill in with question 6. How many missions did you perform in your life? So a total of surgical mission you performed in your life. Then in question 7, please fill in the country where you performed your last reconstructive mission. Okay. In question 8, please fill in the name of the hospital and town this last reconstructive mission was performed in. So please fill in the hospital and the town. So for example, like Hedem, the Terran Hospital, Hedem. Then in question 9, please fill in the name of the NGO that supported this mission. And then in question 10, we also like to know in which country this NGO is based. So those were the more basic questions about you personally and about the NGO and your mission. Then we have some statements following. And first, starting with question 11, where we want you to divide some points over the following potential activities of a visiting team. And so more points means a more important activity. So the first activity is to provide surgical equipment and consumables for the local team, which are also available for use after the mission left. So it could be materials, beds, anything, equipment or consumables. So if you think it's really important, please fill in 4 points.
If you think it's not so important, please fill in 1 point or something in between. Then another activity is to provide free treatments. Another one is to treat patients yourself, so patient care. And the fourth one is to facilitate teaching of local staff, so doctors and or nurses. So please fill in how important you think each of this activity is. Then in question 12, you can fill out if there's anything in your opinion, an activity which is missing in question 11. So this is room for space. If you think something is missing, please let us know. Then in question 13, we want to know from you if you think that medical registration in the host country, should that be required for specialists performing short-term reconstructive missions? So if you agree, then strongly agree, neither disagree, disagree, or strongly disagree. And if you have any comments on this answer, please let us know in the comment section below. In question 14, when medical registration was required for your last mission, the process to obtain these documents was straightforward. Please fill in if you agree, neither agree or disagree. Also here, there's some room for space for comments in this section here below. And so make sure you fill in every question, otherwise you cannot submit in the end. Then in question 15, what can you say about the collaboration between the authorities in low and middle income countries? So for example, like the Ministry of Health, the District Health Management, or the local National Surgical Society, and the visiting surgical teams. So please let us know if there's no collaboration and it should be developed as a priority, or if collaboration is present but improvement is needed, if collaboration has no benefits nor disadvantages, or if collaboration will likely be more harmful than beneficial for the mission. And also here, let us know if you have any comments on your answer or on this topic. Question 16, what should have a higher priority in the hospital of your last mission? Teaching in anesthesia care, as Thom mentioned before as well, or teaching in the reconstructive surgical care? Please fill in one of these options. Okay, question 17. A structured follow-up strategy, which means more than 6 months of patients, is required for short-term reconstructive surgical missions. Agree, neither agree or disagree. Then about the official report. 1 month after the mission, an official report on the outcome, including all complications encountered, is recommended for all reconstructive missions. Also here, please fill in your truly opinion. And please fill in comments if you have some. Then, because we also want to know something about sustainable missions in the future, we want to know if you think a written long-term strategy, so more than 5 years with clear goals developed by the visiting team and the local actors together, is recommended at the start of a new project. So that were our questions, but in question 20, we have a lot of space, what you would suggest to improve the impact of short-term reconstructive missions. And we're very curious about your opinion, and your opinion we will take into account for practical and theoretical, well, we will take it into account for our experiences in the field and also the development of future strategies for missions. So please let us know in question number 20. Okay, so you can send the file to us by submitting it. And if you have any comments or question, please send it to thom.hendriks@gmail.com. And then I will give the word to Thom for the final slides of our presentation. Thanks for participating.
Thank you, I'm back again. one more slide. Yeah, thank you for joining this webinar. I hope you enjoyed it. You can look it back on YouTube if you want to see see it back, or if you missed this webinar. Also, we are very thankful that you have joined and filled in the questionnaire. And it will be used for research, but all answers will be anonymized. And please also make sure, if you have watched the webinar together, fill it in individually. And you can do it either on your phone or on the email. We also would like to thank Scott Corlew for giving the background presentation. We enjoyed this presentation, and we also hope to work together with him in the future. Yeah, I would like to thank you for attending this webinar. Okay, goodbye.